Now, fibroids is a common gynecological condition amongst women, and it is thought that at least 1/3 of women have fibroids. A lot of women don't know they have fibroids because usually they're asymptomatic, meaning that you do not have any symptoms from the fibroids unless you start experiencing heavy periods, for instance. Risk factors for having fibroids can include being Afro-Caribbean. I don't know why Afro-Caribbean are more predisposed to having fibroids than Caucasians or other races. Obesity, not having any children. While fibroids are thought to be reduced maybe in the latter stages of pregnancy, during the menopause, and funny enough, smoking is thought to be a protective factor for fibroids. Fibroids can get bigger due to stimulation by too much estrogen in the body or progesterone. Therefore, there are certain types of treatments that aims to shut down the production of estrogen, which I'll mention later. How do I know my symptoms might be fibroids? Like I mentioned, you can have heavy periods where you're changing your pads 5 to 6 times a day. Each period tends to be heavy, and as the fibroids get bigger, you'll notice that your periods are getting heavier and heavier. Some women can get painful periods, as well as constant abdominal or pelvic pain. If the fibroids are quite big and present on the bladder, you can have bladder symptoms such as urgency, frequency of passing urine, incontinence where you're leaking urine, and you might feel constantly bloated as if you're pregnant. Now, if the doctor examines your tummy, your doctor might actually be able to feel a pelvic mass, which would be the fibroid, and if they examine your insides, your uterus might feel bulky and irregular. But the gold standard for diagnosing fibroids is simply a pelvic ultrasound, which will show the number, location, and size of the fibroids. You can have fibroids inside the wall, you can have fibroids on the wall, and I'm referring to the wall of your uterus or womb. Also, some fibroids can be well hidden, so other tests can include a hysteroscopy, which is a camera test that looks for fibroids, as well as a laparoscopy. Now, while doing a hysteroscopy, if the fibroids are quite small and not too many, your doctor might choose to remove the fibroids. Otherwise, if fibroids are not causing you any problems, you usually do not need any treatment until maybe they get bigger or you have heavy bleeding and you've tried other options of treatment such as a Mirena coil or tranexamic acid, and you're still having heavy bleeding despite this medical treatment. In terms of the Mirena coil, it does not reduce the number and size of the fibroids. The aim of the Mirena coil is simply to control the heavy periods, and that's similar to the tranexamic acid, which are basically tablets to reduce the heavy amount of bleeding that you're experiencing. In terms of definitive treatment, as I mentioned, hysteroscopic removal of the fibroids, which is something to consider if you want to preserve your fertility, as well as having a myomectomy where the fibroids are removed from the muscle of the womb without damaging your actual fallopian tube. Another treatment is endometrial ablation, which uses laser energy or a heated coil to remove the fibroid. However, if the fibroids are just too large or they're too numerous, your doctor might advise you to go for a hysterectomy. A hysterectomy is something to consider if you've tried all other options, medical treatments are not working, if you've completed your family, or if you do not have any reason to have any more children, because hysterectomy is basically total removal of the womb, sometimes the cervix and the ovaries, which means that you're not going to have any more children. Earlier on, I talked about suppressing the estrogen hormones. Now, if you consider surgery that's not hysterectomy, whether it's a myomectomy or hysteroscopy, your doctor might give you a special injection. One injection is called goserelin, and this injection helps to shrink the fibroids to allow for surgery. However, the problem with this injection is that by shutting down your estrogen hormones, it now induces a menopausal state where you get all the menopause symptoms such as night sweats, hot flushes, palpitations, fatigue, you name it. And in some women, some of these effects can be quite unbearable, which is why some women are given HRT during this period of treatment. And it has been shown that some women have actually had osteoporosis, which is thinning of the bone, as a long-term side effect of having these injections. So if you do have fibroids, whether small or large, and they're causing you any symptoms, think carefully about your options, have a good discussion with your doctor. If they're bothersome, you might want to consider medical treatment first before you go into surgery, or if medical treatment is not helping, then you might want to consider surgery. I hope you enjoyed this video. Take care.